Okay, so answering more questions today, and I have a comment. If you're going to go through the trouble of finding my other account, and sending me a message, don't you think you ought to follow that account? A lot of you ain't. And if you think that's a shameless plug to get more followers on my minor account, guilty as charged. Jesus won't rub off on you too much, I promise. This one says, "Hey, Dr. Mike, some advice needed. I see my PCP tomorrow, discharge myself from the pain management clinic. Okay. To get a new referral to a new pain management clinic, and I asked her a Friday for a few days worth of my medicine, Lyrica and oxycodone, so I wouldn't go through withdrawals. And she refused without seeing me. She should. Okay, I'll get back to that in a minute. I'm not in active withdrawal and terrified she won't help me tomorrow. Any advice on what I should say, do to get my meds back to hold me over until my new pain management appointment? I have several issues with S1, L3 spine, and my current situation is being in extreme pain is my right hip is hurting so bad now and without any pain relief while also in withdrawal. Thank you and for your time and your help." Well, excuse me, I'm not going to say that. Independent of my other opinions, I think you shouldn't have dismissed yourself from your current pain clinic until you had a better plan. But I think you probably already know that now. And so I'm going to move off of that point. But for the rest of y'all, don't follow that example. Always keep your current pain management provider until you find a new one. Remember, I've given you lots of advice on how to do that. And I'm going to go ahead and repeat some of that. Remember, you want to see your new possible pain provider a day or two after you just got your refill so that you don't need your medicine right now. Okay? So there's that. Second, I would have arranged with the PCP to bridge you before I ever left the other pain management provider. Okay? Um, it does not look, the reason why the provider has to see you to continue those medications is to explain why someone who had not been prescribing was all of a sudden prescribing medications for unspecified. They haven't even documented why they're sending the prescriptions in. That is medically inappropriate. The DEA looks for that little loophole to try and get everybody. Okay? So if your PCP has not been writing, make sure that you get your PCP to agree before you run into this. Now, something more direct to you. Um, Here's what I would do if I was in your shoes. Make sure that you have the story about how you were being mistreated or mishandled or not listened to, well versed and non-defensive sounding when you go to talk to your PCP. Make sure that you're asking them to understand that all you're trying to get them to do is bridge you to the next provider. Explain that you realize that you kind of made a mistake by quitting in haste, and ask them to please help you out in this situation. You got at least even money that, in spite of all of the little missteps that you made, that things are still going to go your way. And it's certainly my prayer. Okay, I could sit here all day long and tell you I told you so. That's not the goal. That's not my heart. You really didn't do this the right way. I got to be honest. Okay, you put your PCP honestly in a very awkward position, because they probably don't write controlled meds normally. Okay, so it's not as simple. If your PCP does not generally manage pain, it is a bigger request than you realize to get them to manage yours. I'm not saying they shouldn't. I think primary care should be managing 80% of all pain patients. But that doesn't immediately translate to their comfort doing exactly what I think they ought to be doing. So however you approach your PCP, and you said it was a she, so I'm going to say, however you approach her, just make sure you understand that you verbalize how much you need her help and that you understand that this is not an easy situation for her. It's going to improve your chances, and I'm praying that everything goes your way. I don't want to be right. I want you to get the help that you need. I love y'all, no buts.